So I'm Robin Lang, and I work at the Department of Public Instruction in the Office of Educational Improvement and Support. And I'm very excited to work in an area which aligns with my passion. And for those of you that know me, you know it's school counseling. So prior to coming to the department, I worked as a school counselor for over 20 years in North Dakota. And in March of 2020, right as the pandemic hit, there was something kind of tugging at my heartstrings. I missed the boots on the ground work. So I left DPI and I moved to Arizona, and I worked as a K-12 counselor in a rural Hispanic community on the Tohono O'odham Reservation. It was by far the most challenging and amazing year I have ever had as a school counselor. But in June of 21, some family situations changed my path, and I came back to North Dakota, and I was extremely fortunate to return to my role with DPI. So we know prior to the COVID pandemic that North Dakota's YRBS really illustrated that adolescent mental health was moving in the wrong direction. And same with across the country. We see that students reporting of stress, anxiety, depression, suicidality, they were all just trending in the wrong way. And it is just really my firm belief that it's critical to equip our parents, our teachers, our schools, our communities with all the training and tools and resources as we possibly can. So school counselors, you guys are key to that. We're key to our K-12 students, our K-12 families, whether you're in the classroom doing direct education, whether you're offering support, you are providing services for students, staff, families, we're doing referrals out, that whole host of what we do. I kept asking myself, like, what do school counselors need? So we created an advisory team at DPI, and their role was really to guide the strategic professional development for us as school counselors. So what we did is we looked at the current landscape of professional development for you as school counselors. And then we talked about some other areas where we maybe could enhance that. So what we decided to do was add 2 different PD opportunities, and one happened this summer. It was the Virtual Summer Institute for School Counselors, and that was in June. And if you haven't had the opportunity to take advantage of that, I believe you can still view those recordings until December. And then followed by this is the coffee chats for school counselors. And the most recent addition we've had to our work is Mandy and Amy, who with NCEC, who have been the dynamic duo in making these coffee chats really, that concept really come to reality. Please know that if you guys have any suggestions for topics or programs, or you'd like to share some resources you have, please let us know. We want this to be meaningful for you. So please contact any of us and talk with us. We need to know that information. So that's enough about me and kind of how this process began. So we know suicide, September is Suicide Prevention Awareness Month. So for today, we have a spotlight program that'll always happen that first 10 to 15 minutes of a session. Followed by a general session. So our spotlight program today is going to feature the DHHS feature program Cognito, which is going to be presented by Kayla Statsny. And then it'll be followed by our general session, and that's going to be suicide prevention and intervention resources. And that'll be presented by Jennifer at First Link. These are all great partners, and Samantha, who is with NDAFSP. So welcome, ladies. We're so excited to learn from you and with you today. So without further ado, we'll turn it over to Kayla.
Thank you. As Robin said, my name is Kayla Statsny. I work with the Behavioral Health Division within our education initiatives, something that I have not even been doing for quite a month. So the program that I am sharing with you is one that I'm currently going through as well, doing some of the modules. Prior, I spent, 11, 12, 13 years, I don't know, they all ran together, teaching special education in a few districts across our state. Really wish that this program would have been out at the time that I was teaching. So we are just really working to try to make as many people aware of this free resource for not just educators, but any school personnel across the state of North Dakota in any public, private, tribal school. So we have a partnership with Cognito through the state of North Dakota, and we have this partnership through 2024. And they have a variety of different modules, but this particular one was chosen to be maybe one of the most beneficial for our state and the needs of our students across the state. So we do a lot of outreach with their company as well, looking at some of the other programs, and we really want to make this functional for schools. We want to see people using it because we could potentially bring in other modules that would benefit in a variety of different areas. So we are really working to do that. Cognito is a virtual simulation system, and we have 3 different grade levels. There's elementary, middle, and high school that are available to staff. And essentially, you kind of have this virtual conversation with a student who is considered at risk. And the program kind of allows you to navigate not just what you should say, but maybe what you might say in that situation. Allows you to maybe pick some different dialogues that you might throw out there. And then it kind of walks you through if that is hindering or helping that conversation with that student, and how maybe some feedback might get more information, more engagement, different things like that. And it allows you to kind of play with a few different items that you could potentially say. You can undo, you can try again. It's kind of a nice way to just see, like, if I said that, what would a student perhaps say back? And so, like I said, I'm kind of going through this myself as well. So far, it's been pretty engaging. And one thing I really want to promote is to maybe look at the talking points as what you would really say and not what you know you should say. I've kind of tried to do that. What would I have said when I was in the classroom with the student? And then I could see, gosh, that maybe was not the right avenue. And it really kind of has allowed me to maybe check some of my own dialogue, just with a little bit of engagement I've had with it. It's safe, non-confrontational. Hopefully it's pretty realistic to the students that are walking within your school building every day. And it is research-based and evidence-based. And so we really like to promote that as well. Really through it, we have some at-risk learning objectives. It's to recognize warning signs, which really promotes nicely with September being Suicide Awareness Month. How to initiate a conversation with a student, how to connect them to appropriate services, and then using some of that MI to maybe open up the dialogue more than just the yes, no, maybe that we might be used to with some students. So here are the different modules within each grade level. As I said, we have high school, middle school, and elementary school. It should take about an hour to do all of the modules within whatever grade level that you are interested in. And this is just kind of showing the virtual students that are within the simulation. We have anxiety, we have poor attendance, loss and thoughts of suicide, and then even at the elementary level, a parent who maybe has a child in the classroom that is struggling, and how to have that conversation with the parent. And as I said, this is not just for teachers, counselors, principals. It is really for anybody in the school building that may be interacting with a student, not even just during the school day, but maybe an after-school program. One thing we're maybe trying to promote this with is school resource officers who maybe don't have that educational background that some of us do. So really, we encourage anybody who interacts with a student to sign up and have their login. And essentially, you're able to, through this website, create a login with your email address, your educational email address. This is your account. You don't have to share it with anybody. You can just kind of go in there whenever you want to work through it, and it saves your progress. And you can also get to this through our behavioral health website as well. But otherwise, you can just go northdakota.cognito.com and it'll walk you right through signing up. And so we've really been working with Cognito over the last, month since I've really been in this role to try to collect some valuable data and see where we can go from here. There is kind of a survey that participants can take after completing their modules. And what I thought was so important and wanted to highlight is that 98% of the people that have taken it thus far rated it as excellent, very good, good. Most of them felt like it was pretty relevant to the students that are walking into their rooms and through their building, and 93% would recommend it to others. So I think those are some pretty strong numbers to start with. And this map, we aren't in love with it. It just essentially though shows which counties in North Dakota are utilizing Cognito in some way, shape, or form. And we can see that the darker blue is where we have more people engaging, which Cass County is one of our biggest districts throughout the state. So there is just more people. But anywhere in gray is where we really want to try to promote, because that means that nobody in that county has logged into Cognito to even get started. And so we are kind of making it our personal mission that when we pull this report in the future, that every county would at least have a little bit of blue. We really want to see this getting out, especially some of those rural areas that maybe don't have as many resources as a Bismarck, a Fargo, a Grand Forks, etc. And I won't read these, but these are just some of the comments that we have gotten from that exit survey. And as you're reading, each school, each district is utilizing Cognito in a little bit of a different way. They kind of take it and use it however it's going to fit within their school. We've had some schools that just tell their teachers and their staff, hey, by December, we want you to have a certificate of completion with the modules. Give that to us and it'll show that you've completed it, because it can count towards some of those mental health hours that are required with Century Code. Some schools have taken, they do have some offerings for additional resources, some talking points. So some schools have brought this into maybe their teen times or their professional learning communities to do the scenarios, but then also talk through them. And so, like I said, each school district does it a little bit different. We just want it to work for your population because we know each population and each school is so different. But what we have gotten from the feedback is that it's realistic. We had several people say, I wouldn't have had to go straight to go see the counselor. I was able to kind of walk them through some things that maybe I wouldn't have done before. And so that's pretty powerful that we can equip staff to, have some of those conversations and help connect kids to the resources based on what is happening in their life. So if you have any questions, if you are thinking that maybe you want to try to roll this out within your school, within your district, please reach out. I would love to try to help present to whomever you may need presented to. We just really want to get this into the hands of as many people working in our schools across North Dakota. Does anybody at this point have any questions for me? Perfect. I know it's 3:30 on a Tuesday and everyone is tired, but there is my contact information. And so if you think of something after, please reach out. If you know of any other groups that may benefit from hearing this, maybe a group within your school district, maybe some administrators, please let me know. Like I said, we are just trying to get the word out to as many people as possible because it is a free resource and that is not always the case. So. And just kind of going through, since I have you here, I won't really go into a lot with our Be Hero and our behavioral health resource coordinators. Natalie and I actually had a conversation the other day and we still hadn't even met each other. So still kind of new to Be Hero myself, but just wanted to remind everyone that each school is required to have an identified behavioral health resource coordinator. And so if you know that the person in your school that had been that contact in the past is no longer there, please reach out to Be Hero so that we can get somebody else established. They are sending out some great resources, and we want to make sure that those newsletters and resources get into the schools, get into the families. So. And last but not least, I have to give one plug. We have our big kind of our Christmas within the behavioral health division, but we have our behavioral health and children and family services fall conference coming up in October. This year it is in Fargo. We are offering virtual and in person. So if you're not able to sneak away, but might be able to do some of the virtual sessions, I encourage you to do so. You are able to get some CEUs, both regular and in ethics, which are always exciting to get. So if you need any more information, you can find that on our website. But otherwise, that is, I don't know how to turn off my sharing now. Oh, here's pause. That would be a good place to start. But if you have any questions, feel free to reach out. We have a variety of different initiatives we're working on. And so I am sure I will be back if allowed to talk about some of our programs in the future.
Okay, thank you. All right.
It's been super great to hear from you, Kayla. And I'll just, in final words, I'm the Natalie, the mysterious Natalie that she's referencing. This is the first time Kayla and I have gotten to see each other face to face. But for those of you who are familiar with Be Hero or maybe the behavioral health resource coordinators in your schools or districts, you likely have already heard whisperings of Cognito before. I just want to remind you or let you all know that there are implementation resources if you were to want to introduce Cognito as a collective staff learning opportunity. And so I will drop a couple of resources just supplemental to what Kayla has given us in the chat window from Be Hero to help you get connected with those. So thanks all. Happy to support however we might be able to through Be Hero.
Thank you, Natalie. All right, Jennifer, I made you co-host, so
okay,
you're up.
let me see. I'm just gonna share my screen here, maybe.
We can see it.
You can see it? Okay, perfect, wonderful. So thank you for inviting me to present today. I really appreciate that. And just to let everybody know about our services, my name is Jennifer Illig. I am the Executive Director at FirstLink. Today I just want to tell you about FirstLink and kind of what we do, why it's good to know about FirstLink and how we can kind of partner up with the schools. FirstLink believes in fighting the stigma of mental health issues and suicide through the services that we provide. So just kind of briefly on some services that we provide, and then I'm going to jump into just a couple of these more in a little more detail. So we answer the 24-hour helplines, the 988 and 211 helpline. Talk about that in a little bit more. We do training on suicide prevention and mental health too. I love that program you guys are looking at. Living Works has a similar like hour or 90-minute program on like talking to people about thoughts of suicide, and they did such a great job, that virtual training. So it looks kind of similar to what they came up with. We also have a care and support program. Our care and support program is teaming up with hospitals and like internal phone calls to make outgoing calls to people. So we usually call them about once a week for about 3 months. But really today, what I want to talk about more is our phone lines. So if you have a student, a parent, a coworker that is struggling, so you can notice that they have like signs of anxiety or depression, they have thoughts of suicide, one person you can count on is the 988 or 211 phone lines. In North Dakota, we are considered blended. So FirstLink answers both the 211 and 988 helpline for all of North Dakota. So really there's no wrong number to call. You can call either, you'll get the same staff that's trained. Both phone lines are free, they're non-judgmental, they provide emotional support, and they're 24/7. So we are not counselors like the school counselors, but we do motivational interviewing, listening and support. We link people to higher level of need if they need to. We tell youth a lot, have you talked to your school counselor? Yeah, let's get them on board. We think when it's behavioral health or thoughts of suicide, we really need a whole team of people, right? We need a school counselor that they can depend on during the day to have a safe place to talk to. We need 24-hour support that the students can go to talk to. Just some people like stats. We have a page on stats in here. Last year, so in 2021, we took almost 84,000 calls last year. Of those calls, we gave out resources, and I have some slides coming up with the resources. We gave out 28,000 resources. Calls related to suicide last year, over 15,000 calls directly related to suicide. Our calls related to suicide did increase for the youth population in the last couple of years. Because of all, a lot of COVID reasons. They were home alone, parents were working, they were trying to do homework at home when the parents were gone out of the home. And it was a stressful time for adults, but really stressful for the youth too, is what we heard on the phone. Of those 15,000 calls directly related to suicide, we do at times break confidentiality to call law enforcement. So if somebody cannot stay safe at home, or if they already started the process of suicide, 91 times last year we did call law enforcement to do a welfare check related to suicide. So we have a confidential line, but we do our mandatory reporters. So if, at times we do call for law enforcement to be our backup. That being said, we do work with the mobile crisis centers throughout North Dakota. And I don't know if you guys are familiar with mobile crisis very much, but the 8 human service centers have mobile crisis, and they can deploy therapists out to the home within like 45 minutes of the main human service center. So like 45 minutes within like Bismarck or within Minot, within Devil's Lake, kind of our bigger cities. Ways to connect with FirstLink, it's pretty easy, 24-hour support. You or the students, they can simply dial 211 on their phone. So really easy to call. They can simply dial 988, or they can text ND for me to 898-211. They can text their zip code too, but we found out a lot of youth and then college students that were moving into North Dakota didn't necessarily know their zip codes. So we started text your zip code to 898-211. That still works. We'll still get the calls, but we also do it North Dakota for me, so they don't have to know their zip codes necessarily. What we think is a great thing to do with our youth is to call 988 with them. So when we present in front of students, we do it right in speakerphone in front of the whole class. But if you have somebody that you're worried about or might be thinking of suicide, just put your cell phone on speakerphone, or your classroom phone on speakerphone, and dial 988, just so they can know what it sounds like. And one teacher in Grand Forks does it all the time. So during his health session, he'll call like 5 times in a row that day because he gets to like the suicide intervention part. And we love that. He just, introduces himself, says I'm on speakerphone with the classroom of students. We want to know what it sounds like to call 998, and that's great, I think, for people can see it. Just a little brief about, we have a community resource directory, and this might be helpful to your parents if you have kids that are coming in without winter gear. They don't have enough food in their homes. They're struggling to pay rent. Their car broke down. Now they can't get to school because they need a new tire for their car. If you go to myfirstlink.org, we have a community directory. So 5,500 services throughout North Dakota. So North Dakota is full of a lot of great help, a lot of great nonprofits to do a lot of great things. One thing FirstLink does is get all those helpers, therapists, support groups, places for employment, shelters, and we put it all in one place so everybody can easily access it. So you can dial 211 for this information. You can go right on our website, myfirstlink.org. Everything is posted right on our website, or you can text your zip code to 898-211, and we can text you the information back. There's like embedded Google Maps, which is nice because if you're in Bismarck and you need a food pantry, you have to take the bus for transportation. You're going to want the food pantry that's closest to that parent that we can get them, So we can look at the Google map and see which one's closest to their house. Printed material. So for your school, I think one of the things that FirstLink we are always working with is letting people in North Dakota know that they can call 988 or 211 24 hours a day. It's a free call. So if you guys at your schools want to do some printed material, you can go to our website. I have the website link right under there. And I would suggest hanging like posters by water fountains, bathrooms, on buses, just any common area of school, just for when the students walk by, they see these posters and they know that there's help and hope out there. And to print, you can go to our website and you can print in black and white or print them in color right at your school through the copy machine. If you want them like a nice quality, you can order them through our website too, and Sir Speedy will print them, laminate them, and send them out to you. But that gets expensive, so the school would have to pay for that themselves. But you can just print them too. I know schools have really nice printers and usually laminators, so you guys can do that. I just did a screenshot of some of our posters. We do have a couple new youth ones that are going to be rolling out probably next week. So if you look at our website next week, there'll be 2 new ones. We kind of made them just, are you hungry, lonely, or sad? We can help. So maybe for more elementary, middle school, school can be hard and life can be lonely. Go here for help. So we just tried to do some general pictures, different like target areas on there. So like I said, 2 new ones coming, but you guys can help out, print some of these, hang them in your school. I think that would be great for the students in all of our areas. And then the last thing I just wanted to say is with our increase in volume with youth calling, and the youth are talking about anxiety, depression, they're talking about suicide. On the phones, the youth are telling us that they want to talk about suicide, but that the adults in their lives are not ready. They cannot talk to their parents or adults in their life about suicide. So what we wanted to do is give them a medium to speak out. So last year we did our first ever film festival. So we had high school and college age students make short films, so I think 1 minute to 5 minutes, about self-care, anxiety, depression, suicide, and submit them. We went to the Fargo Theater in the small Fargo Theater area. The youth got to see their films on the big screen. It was really fun. So if you guys have a great after school group or a school group that likes to video, most of the youth just made the videos right on their iPhones, you know, nothing really fancy, but we had some great sponsors. So we gave some great, like $1,000 check and $750 and $500 for first, second, third place for high school and then college. So it made it worth their time. They really learned a lot about suicide prevention. And actually the youth that won, they still connect with me a lot, just to tell me what they're up to, what they're doing, that they want to be in behavioral health now when they grow up, because they really learned a lot about themselves. So that was a really neat connection. So our posters for this event, it'll be in April 13th. It'll be coming out soon. So you can watch for this too, if it's something you're interested in. Any questions on 988 or 211?
So Jennifer, if they wanted to set up a practice call just to kind of normalize what that conversation might look like, do they just call anybody ahead of time first, or do they just go ahead and call?
I would just go ahead and call. So
Okay.
if you call 988, first you get a national like voice. And I always think that's good to listen to, because to me it's really slow. It says you have reached the 988. We can't change that. It's because the phones are out nationally. Then when it's 701, boom, it knows to come to over to First Link. I think it's good to just let students hear that and know what it is. And then if they dial 211, we answer the phone and we say 211, what city are you calling from? Just because most of the time people call 211 for like help with rent or help with food pantries. So we want to know their city right away. But they can say, I don't want to tell you my city. And we'll say, okay, that's okay. Because they don't have to tell us our city. But I think it's just great to try it out. But just call anytime. You don't have to schedule it or anything. And then you can get like a true what it truly sounds like when somebody calls and picks up the phone. If you ever have bad service, let me know. But our call specialists are really, really trained.
Okay, thank you.
Yep.
I have one more question. So in regard to the mobile crisis unit, because that's a new concept for me here.
Okay, yeah.
So how does that, is that new for our communities and schools, or how would a school use it, I guess?
So I'm glad that you asked. So the 8 human service centers now have what's called open access. So Monday through Friday, 8 to 5, somebody can go in there and get seen immediately for behavioral health. Now they necessarily won't take them for a long-term client, because mostly human service centers mostly work with people with no insurance or low income, but they'll see anybody. Like I could go in there and they could do an evaluation and start my treatment, then that'd help me find a counselor to go to. So there's open access during the day, but you have to go there. Mobile crisis is mostly for after 5 nights and weekends. After 5 weekends and holidays. So I don't know if the school would be able to utilize it very much. That being said, I know they're trying to work with schools in a different way during the day, but I think that's kind of newer to them.
Okay,
But it's mostly for your parents to know when their child, when you send the kids at home, if they're having like horrible bedtime routines or horrible mornings or some kind of after school problem, and you guys know that, you can maybe just let them know that there's mobile counselors that could go right out to their home. So I'm guessing you guys can't go into the home. These ladies or these guys can go into the home and help them with like bedtime routine or whatever they need help with.
oh, that's awesome. And that
Yeah.
open access is so nice instead of, a lot of times they might go to the ER if that's farther away. So an
Yep.
open access at a human service zone is great. It's a
Yeah,
great
that's great
option
too.
for
Yeah.
families.
Yep. First Link, we're teamed up with Human Service Centers. So after ours, our phone calls come to us. So we do like a triage. We'll do the triage screening and then deploy out the mobile crisis. So if a parent calls, they'll get a staff at First Link. We'll ask a few questions, gather their name and address and what's kind of going on. And then we'll link them to the Human Service Center on call. Make sure that we get somebody over there to help them out.
Great, thank you.
Yeah, thank you.
All right, now we'll hear from Sam.
Okay, wonderful, wonderful. My name is Sam Christofferson. I'm from the American Foundation for Suicide Prevention North Dakota chapter. Really today, I want you to be able to know all about AFSP and the resources that we can provide to your school, as well as we can either bring these programs in or we can train you to do these programs within your district. Really, AFSP just wants to be here and provide resources on whatever level that we can give it to you. So just some background information because it's really helpful. A lot of people haven't heard of what we do. It is our mission at AFSP to save lives and bring hope to those affected by suicide. We're a voluntary health organizations, and we're very, very active on the national level, but also on the community level. So we expand the entire state of North Dakota. So no matter where you are in North Dakota, we can use our resources. A lot of people think if they don't have an Out of the Darkness walk, we can't bring resources. That's definitely not the case. The Out of the Darkness walks are really our avenue to get people to know about us and to fund these programs. So again, we are a statewide chapter and we can bring programs throughout the state. So a little bit about the work on we're very active in research, we're very active in advocacy, we're very active in prevention education, and we're also very active in support for loss survivors. Again, we are built up of a network of chapters. So a little bit about AFSP, we are a national organization, but we're built up of a series of chapters. So it's kind of the best of both worlds. We have that power and expertise of a national organization, but we're doing things on the local level. So we have volunteers across the state of North Dakota that can provide these programs to your school, as well as, with that national component, we know that the information is good, it's safe, it's evidence-based. We know that it's accredited information that we can use on the local level. So again, that's kind of the best of both worlds there. So again, I'll say this a lot, but it's really, really important. AFSP National is the #1 private funder of mental health research. That's something that we're incredibly proud of because the more that we know about suicide, the more that we know about mental health, the more resources, the more tools can be created to help more people. This happens on the national level, but of course it trickles down into the local level. So when we talk about local programming that we do within the schools within North Dakota, again, we know that it's evidence-based, it's evidence-informed, it's good information, it's safe. As well as if you want to learn more about some of our key research studies, you can go to afsp.org/learning-more, as well as you can also go to afsp.org/research about our specific research funds. This is really helpful because we have researchers across the network really explaining what they found in their research findings. And it's helpful because of course, these are all published works, but if you don't have a huge research background like myself, it's a lot easier to kind of watch the clips and get that information. There's a lot of great information. Again, you can go to afsp.org/learning more. There's information on a number of different studies, some of the ones that are most popular, why we need to support survivors of suicide loss, why it's important to use proper pronouns and how that leads to suicide prevention, lethal means information. Again, all of that can be found at afsp.org/research, as AFSP is the #1 private funder of mental health research. Of course, on the local level, this is just a very, oh, I think I accidentally deleted one of my slides, and I'm really sorry about that. So I'm going to stay on this slide for a moment, but we have a number of prevention education programs that we can provide to our communities. Again, our communities across the state of North Dakota. I think I accidentally deleted it with my thumb. I'm so sorry. So a number of different programs that we can provide. One, Talk Saves Lives. This is an introduction to suicide prevention. For lack of better words, it dumbs down a very complex topic so we can all learn and understand. We go over statistics because they help us see the scope of the problem of suicide. We cover some key research findings, what we know about suicide. And then we talk about how to be proactive, how we can take care of ourselves. And then we also end this program with how do we have an honest, caring conversation. This is a program that would be great for maybe a parent night or a teaching for your staff, for teachers. So again, that's Talk Saves Lives. We have multiple different modules. Talk Saves Lives for the firearm owning community, Talk Saves Lives for the LGBTQ community, Talk Saves Lives for workplaces. This would be a great program that we could use in a number of different ways. One of our newest programs, it's called It's Real Teens and Mental Health. This is a program that we can deliver to 8th through 12th grade students. We can deliver it in about an hour. It works best if we're in the classroom. Again, we don't want to do big assemblies because we want to make sure that we're in a safe, intimate space so that we can have these conversations. But It's Real Teens is all about, we kind of start with talking about what is mental health, because we kind of hear the form, but what does that mean? We talk about how we can notice that our mental health might be deteriorating. We talk about what signs to be on the lookout for. And then we kind of talk about how having conversations around mental health is really awkward and it's really scary, but we need to cease that awkward and have these conversations. So we've watched a few different clips from Seize the Awkward, which is our national PSA campaign, which is, I think, really, really great. You can check that out at seizetheawkward.org. Really, there's a lot of influencers and YouTubers and really talking about how they have struggled with their mental health and how they got help. So again, we want to normalize that. But going back to the It's Real teen program, we can deliver this in the classroom. Again, we go over signs. We watch the Seize the Awkward clips of how do we have these conversations. We want to normalize these conversations so it's less awkward. No one needs to be embarrassed. We all have mental health. Then we go into the what if scenarios. What if I know that my friend is hurting themselves? What if I've heard my friend talk about hurting themselves? What if this is all really overwhelming and I don't know what to do? Who are some trusted adults? Who do I talk to? These are all, we go over this in the programming. And then we end with what resources are available today to help us if we're having these conversations. And we always give shout outs to First Link as well. So that's a really great program. Again, the target group for that program is students 8th through 12th grade. We want to deliver it in the classroom, not a mass assembly. This is a free program. We're not allowed to charge for this program and we're not allowed to say no, which on my end, I think those are great rules to have. So again, no matter where you're in North Dakota, please reach out to the chapter and we would love to provide that program to your class. And again, we want to do it in classrooms. So we'll be there for a few days. We'll do whatever you need if we can do those classrooms. We do have Gizmo's Possum Guide to Mental Health. It's Possum because Gizmo is a dog. This is suicide prevention before suicide prevention. The target group for this program is kindergarten through 4th grade students. Really, this is a storybook, right? We're talking about safe coping mechanisms, acknowledging how we're feeling, acknowledging safe adults that we can talk to, and then there's, a craft and a curriculum after that. This is a booklet that we can send to your school, again, free of charge, but again, also, we would love to provide the curriculum to go with it as well. We never want to do a one and done type of thing. So those are the most popular programs that we have for school districts. Again, Gizmo's Possum Guide for Mental Health is for kindergarten through 4th grade, and then our It's Real Teens and Mental Health are 8th grade through 12th grade. We're not allowed to say no, we're not allowed to charge. So that's really important. For adults, we also have Talk Saves Lives, which I talked about. We also have Introduction to Supporting Those at Risk, which is a program for family members who have loved ones with lived experience. Maybe they've been hospitalized after an attempt. They want to be supportive, but maybe they don't know how to be supportive. That would be a great for a parent night, great use for teachers. That's a great program as well. Now going back to the slide that's actually on your screen, we have a number of printed resources here, information after a suicide attempt, lifesaver guides, information about knowing the signs. These are programs, or these are printed resources that, again, we're not allowed to charge. Please reach out to the chapter. We will ship it to you in bulk. As long as you're using them and they're not in a closet somewhere, this is a great use of our walk funds, and we want to get them out into the world. A few of these programs on the loss and healing side include the Children and Teens Suicide Loss Booklet. This is a booklet that was co-created by AFSP, we're experts in suicide prevention, but also the Dougie Center, who are experts in children's grief. I can't order enough of these books. I send them to schools. I give them to parents. Please reach out if you would like that booklet. Again, there's no cost. I know that there's a lot of schools that we kind of have, the counselor team just kind of lets us know when they're out and we ship them. Again, there's no cost to those resources. So please let us know if we can get those resources to you. Within this realm as well, we also have at AFSP, we're also very active in support for loss survivors. If you've lost a loved one to suicide, you know that it's a very unique type of grief, and it's so important that you know that you are supported. So there's a number of programs within this realm as well. We are hosting International Survivors of Suicide Loss Day in multiple sites across North Dakota. This is a day where loss survivors can heal and connect and get connected to resources. We also have healing conversations. These are led by trained volunteers, but they're also loss survivors themselves. So if a family is recently bereaved, they can get connected, they can talk to someone who has been through it, and they can get connected to resources. Within this realm as well, we also have After a Suicide, a toolkit for schools. This is a program that was created by AFSP National, the Trevor Project, and the American Counseling Association. This is a great a resource if you need to use it in your school. Templates, sample emails, they are already created for you to use and best help students if they've lost someone to suicide. Again, that can be downloaded for free from our website, but you can also reach out to the chapter as well. A little bit about AFSP. Of course, we're also very active in advocacy, helping our advocates from across the state make connections with their legislative leaders. We're very active in that. Of course, we have Out of the Darkness walks across the state of North Dakota. I just want to reiterate, even if you don't have an Out of the Darkness walk in your community, you can still have resources. So I want you to know these walks make it possible, and we want you to make sure we get you connected to resources. And of course, I can't not talk about AFSP and not talk about Project 2025. It's our bold goal to reduce the suicide rates 20% by the year 2025. And we're active in, we broke it down into 4 critical action areas: firearms and suicide prevention. Critical action area number 2. Critical action area number 2 is healthcare systems, 3 being emergency departments, and 4 being correctional systems. I know that was a lot of information, and I'm so sorry that my slide, I don't know what happened to it, so I do apologize there. But I also want to remind you there are a lot of free resources, great information that AFSP would love to provide to you and your school. As well as, I know a lot of you are very familiar with our model school district policy. This is created by AFSP National, the Trevor Project, and the American Counseling Association. Unlike the After Us Toolkit for schools, this is a document, this is a plan that you can use within your district to create a task force for suicide prevention. So what trainings do you need to do, how to reach out to parents, how to have these conversations. There's information on how to welcome a student back after being hospitalized after an attempt. There's information on how to handle social media. I wanted to note this just because I know a lot of you are familiar with this resources, but it has been updated in the last 2 years. So if you have the old one, it doesn't cover social media and that information. So reach out to the chapter. You can download it from our website, or I can send you a free one as well. And again, just on behalf of AFSP, we have lots of great resources that we hope that you can use within your district. And again, the resources that I talked about today are free of charge.
Wow, thank you so much, Sam. I learned so much about all of your resources. I'm going to reach out to you and get copies of things. That was great. Robin, do you have anything to add?
I do. I just have a couple of questions. One for Sam. Sam, do you guys still do the More Than Sad program?
We do the More Than Sad program. There's 3 different modules: More Than Sad for parents, More Than Sad for teachers, and More Than Sad for students. It's a great program. It's evidence-based, of course, but I'm going to be very honest, it's a bit dated, right? So
Okay.
if you're familiar with that program, AFSP on the national level is working on an update, but for the student resource, I would encourage you to do It's Real Teens. I really like this program. It's really, really good. We've done it in a few schools already. It's one of our newest programs. They're engaged, they have discussions. Instead of asking questions, someone put, "I really needed this today. Thank you for being here." That's just great feedback. So again, we do have More Than Sad. Again, we can offer that, but if you're going to do it, I'd recommend to do It's Real instead.
No, I appreciate that feedback and that honesty. And so I know you mentioned, these guys are going to go and they're going to go to their families and all the things that they need to do today after 4:30. And so I know you mentioned a couple books. You mentioned the toolkit, the model policy. So if those are like links you could send us, or just something you could drop in the chat, because Amy and Mandy are going to take all these chat links and do some magic in the portal, so they'll be there for the counselors to quick grab and go, because that's always our struggle, is when these type of things, we just need quick grab and go resources that are organized. So it's kind of our goal. Would you be able to do that for us?
Absolutely. I'll drop it in chat. I'll send you a very detailed list of links so that you can just find what you need. Also within the loss category, if you have a student that has lost someone, the quick link is afsp.org/loss. All of our information is there to get them connected. For our community resources, it's afsp.org/community resources. But I'll drop these in the chat as well.
Thanks. And I didn't see any other questions in the chat, but does anybody else have any questions for any of our presenters today?
A question for Samantha. The program that you bring that grade 8 to 12th grades, is it an hour? Could it be whittled down to about 15 minutes?
Yes, it can be edited down. I really like it and I think everything is so good, but yes, we have a condensed version that because we want to meet you where you're at, we know that we might not have more than a class period. So yes, we can edit a few things out to do like 50 minutes. Yep.
The others should do that, wait to schedule time to come in for a day.
Can you say that again?
How would I get connected with you guys so you could have someone come out and do that presentation for the day?
I'm going to put the information in chat. You can request information at afsp.org/North Dakota, but I'll also put my email, if I can spell correctly, in the chat as well, and you can request information. And again, we cover the entire state of North Dakota.
Awesome, thank you.
I think she also asked if somebody would be able to come out and present.
Yes, so when it comes to these programs, someone from the chapter can come to your school and present these programs or facilitate these programs. Again, there's no cost, but as well as at AFSP, we're all about empowering our community. So if this is something that you wanted to be trained in so that you could do that, of course, there's a process, but we could do that as well. On AFSP's end, we want to meet you where you're at and find ways to deliver as many programs as possible. But of course, I know that you are all overwhelmed and very busy, and so are teachers. So if that is a way that we can provide resources, someone can absolutely come in and do it for you.
Thank you.
Great. Is there anybody else? Anything else? All right, perfect. Well, as I said, this session will be recorded. So if you have counselor friends who want to learn about all sorts of suicide prevention resources, tell them to log on and it should be there. It'll be there within the next couple of days. We'll get it up there. And same with all the resources. We'll link them so they're all there and available to you so you can find them all in one spot. So the next 2 sessions, I did open them up and you can register for them whenever. You don't have to yet, or you can if you want to just get ahead of the game, but they should be there for you. And it's going to be the 2nd and 4th Tuesdays of the month. Anything else, Robin?
Nope, I'm excited. Please reach out and contact us. Let us know what you need. We'd love to build this program for you.
Yep, sounds great.
Thanks everyone for your time. We appreciate you.
Great, thank you.